What's up, everybody? Welcome back to Group 25's podcast. We're here today with just myself, unfortunately, but that's okay. Um, make sure to like, comment, subscribe to our videos. We're trying to get that 1K for the EC. I'm just dropping random acronyms here. But anyways, let's get started. We're talking about healthcare informatics. So what is healthcare informatics? The integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. It's been around for about 30 years and is still currently growing with how technology is growing. These are just the different subdivisions of healthcare informatics. Prospects of healthcare informatics. So what has healthcare informatics improved? It's improved delivery of care, improved health outcomes, and advanced patient education. It's very important for advancing patient education because it's much easier to relay and display information. It's caveats. Sometimes it can be difficult to learn stuff like that, but also for the most part, in the long term, it's been a really, really good addition to medicine. So the policies behind healthcare informatics. Obama signed the American Recovery and Reinvestment Act, which passed an initiative known as Health Information and Technology for Economic Clinical Health Act, otherwise known as HITECH. HITECH is responsible for meaningful use programs that encourage use of electronic health records through incentive and punishment. It's really important for obtaining patient data and hospital information much more efficiently and quickly in the long run, and can enhance care greatly. If you'll take a look to the left, this diagram here shows an electronic health record, and you can tell, although it's organized, it's very hard to read, and it can be difficult to read, especially when you're new or something like that. So that serves as one of the most challenging things that electronic health records have is that learning curve and learning how to use different systems. Clinical implications. Technology informatics allows for data collections. We have online portal systems, electronic medical records, and personal data devices. And we already talked about all of the laws and stuff like that. So moving on. So in this article, we read about an app. And this app can facilitate better medical consultations and identify disease trends. Basically, patients would put their health data into an app, and then it would be tracked in the electronic health record system at a hospital. Doctors could essentially just review it and be like, oh, you may or may not have this, or you may have that. And it was much easier to identify short-term and long-term disease trends among patients. Managerial implications. They are used to facilitate payroll, perform administrative healthcare work, and streamline decision-making from a managerial standpoint. In my opinion, I really think that electronic health record programs' effectiveness trickles down from policy to management to clinical. I believe that in terms of management, their focus should lean towards utilizing EHR programs to make the lives of the clinical staff easier and also create effective, efficient methods of communication. Policy implications. With so much information collected from EHRs and other healthcare systems, public health staff need to work in many different aspects of healthcare in order to analyze and make sense of the information. With the data, issues concerning public health could be better managed and better organized for policymakers to address them. Lastly, privacy. One of the key components, or one of the key, or not components, but problems with electronic health records is HIPAA. So HIPAA is essentially the Privacy Act, and it protects patients' confidentiality. So with this technology, that means that increases the chance that someone can get hacked, or patient confidential data could get out to the public without their permission. So stricter policies and secure data management need to be set in place to protect private information. That's something that healthcare workers, tech innovators, and policymakers are all working together towards in order to improve healthcare services while also keeping the patient safe. Commentary. I really enjoyed the app article. I thought it was really cool, and I really like the idea of having a doctor on your phone. Just to be able to put stuff into your phone and then have a doctor be like, hey, you might have this, or you might have that. That is the definition of technology and informatics all combined in one. I just think that's amazing. With the other article, I just really liked to learn. I really liked learning about electronic health records and all that stuff. I thought it was extremely cool, and I just really thought it was informational, especially the things about managerial implications. I didn't know that they had to go through that process just to teach their clinical staff. So thank you for listening, everybody. I hope you have a good day. Once again, make sure to like, comment, subscribe to Group 25. We're trying to get 1K views for that amazing, super awesome extra credit. Thank you for listening.